So you're the lovely sister of a patient we just did a neck lift on yesterday.
Yes.
It's less than 24 hours later.
Right.
And you've been taking care of her.
Right.
You brought her, you took her home, you've been with her, and you brought her back for her first post-operative visit less than 24 hours after the surgery.
Right.
I'd love to hear, and I think the other people want to hear, how has she been doing with your involvement?
She's been doing very well. Pain wise, not as bad. We give her the medication like within maybe 5 to 6 hours. She takes with food and fine. But no, I think she looks great. I could really see the difference between the before, how she was before, and how she is now.
And why did you think your sister decided to do this under local anesthesia?
Fear.
Fear.
She was fear of being because her age of actually being completely out.
How old is she?
She's 80. She just turned 80 in January.
That's pretty brave to do it at 80.
Yes, that was always her dream. She always wanted to do it. She's been going back and forth with it for a while, and I encouraged her. I said, "Look, that's what you want, do it. It doesn't matter what anybody else thinks, But she looks great.
So
I'm very proud of her. Yeah,
very proud. Yeah, I mean, I am too. She's a trooper. She looks like she just woke up from
big different, big fresh.
So tell me something. I think the patient audience wants to know also. There's a fear in the darker skin tones that incisions and surgery can lead to bad scars.
Right.
So did you guys discuss that at home? And or did you guys have fears about it?
I'll give you a perfect example.
Yeah.
I'm dark skinned.
Yeah.
Darker than my sister. I had breast reduction, no scarring. I did have a tummy tuck, no scarring. And you see what color I am. I didn't have no keloid or nothing. I didn't develop anything like that. So I encourage people, that's nothing they don't need to be fear. Matter of fact, I think they do better, be honest with you. I've had a couple of friends who's had surgery, and there's been no complaints of keloids or anything, or of the scarring and so on. So I don't think it's something that people needs to be afraid of. I think it's more of a myth. Science has changed so much, but I was scared at the beginning because I didn't know.
Well, I mean, I don't know if I would call it a myth. From my perspective as a surgeon, I always want to put context and make sure that everybody understands. I think it's individual based, right? It's not, you can't make universal statements, or we shouldn't, because we don't know. Everything that we do in medicine is very customized to the person.
Right.
So if there's a history of good scarring, that's favorable, and you had a family history of good scarring, and you've had surgery yourself and you had good scarring, the fear of having any bad scars, even if it's done on the face, is very minimal to none.
Right.
That's why screening and educating and talking about it and asking about the history and family history and stuff is important.
Right.
And if there is a history of having bad scars, you could still do things, but you have to modify the technique and modify the approach and what you do, what you shouldn't do, things like that.
Right.
And the post-operative course and all that also may be different than another person. So, for example, if you decide to do something in the future, let's just say, the fear of me or you having any scars are minimal to none because you've already had and you're doing great, and so is your sister.
Right.
And I know that about her because I've known her for some time. But that's I think the summary of the scar stuff.
Yeah, but what I mean by myth is because everybody was telling me if you're black, you're just gonna automatically you're gonna have real bad scarring and everything. That was everything that everybody was telling me, and I think that's what a lot of people who are dark skinned believe, because that is what is put out there. So, like you said, maybe through education, to learn that it's not everybody, like you explained, history and so on like that. But that is what I mean by the myth.
Awesome.
They automatically tell you, that was one of the things that I had the fear of, because this is what they would tell me. But I had a good doctor who explained, just like you did explain, the pros and the cons and so on.
So tell me, I mean, were you surprised at the fact that she did this, fairly big surgery under local anesthesia?
Yes, I really was. Initially, I thought she was going to have to be under, so I was a bit concerned about that, like I said, because of her age. But when I found out she was doing it under local, I'm like, wow. And, I was like, I didn't know they could do that under local. I mean, that shocked me. You know what I'm saying? But, actually, the hours didn't seem to be as long as I thought it would have been. Was it 4 or 5 hours?
4 hours,
like yeah. And,
was it 4 hours?
Yeah.
Well, we did 2 things, right? We did the neck and some of the jowl and cheek.
really surprised. She looks real good.
So based on what you've seen your sister go through since yesterday to today, is this something that you feel comfortable to do things under local anesthesia, or how about what is your view? If you have to do something or somebody else has to do something, would you recommend it? Or
I would definitely recommend it because there are a lot of people who's afraid of going under. But to see what the outcome is, I mean, it's great. You know, there are a lot of people, like I said, who are terrified of going under. And like I said, a lot of things that people was telling me, they're like, well, she's 80, that might be dangerous, I said, no, but she has a good medical history. She had all the tests and all the lab works that was required and everything like that. So I think she's fine. She followed all her instruction, everything she was supposed to do, and so far, it's continued to follow everything. So
great. Thank you so much for your feedback.
No problem. And thank you.